Welcome back. In this lecture, we are going to explore the ethical challenges surrounding technology, social media, and telehealth, also known as distance counseling. This is a complex topic and there's a lot to unpack. However, before diving in, I'd like to provide some context on the evolution of the counseling field. Many years ago, professionals spent a significant amount of time handwriting paper notes, and you can see that by hand. They were writing progress notes as well as assessment and this can take up a lot of time. They used to take up full binders, and this is something that we have kind of moved away from now with the advent of technology and electronic health records. Most agencies nowadays do use electronic records, and some states have developed specific electronic record systems that providers are moving towards and getting away from the paper records. While electronic records have streamlined the process, they've also shifted the focus away from the individuality of each client. Technology has allowed things to move much faster, but we also need to be a little bit cautious. As shown in the screenshot, the system often requires simply selecting buttons. Normally, there's drop down buttons that offer you various different choices with the text box that you can type into with specific concerns. The danger of this is that we may rush through the process, taking advantage of the efficiency of electronic record system, but at the cost of personalizing the work that we do. So it's essential to remember that we are still responsible for capturing the essence of the clinical work and reflecting on the client's progress or lack thereof in an ethical manner. So this means that we must ensure that our work is documented correctly, ethically, and in compliance with third-party payers, audits, and licensing bodies. We need to document medical necessity and do so in a timely fashion. Although technology itself is ethically neutral, it is our responsibility to integrate our ethics into how we use it in our everyday work. The rise of innovative technology in counseling also brings challenges. For example, consider professionals who perhaps have been in the field for over 30 years and they are accustomed to writing detailed progress notes by hand. Many are now required to use electronic systems, often as part of their job role, and this can be a difficult transition for those who struggle with technology. It's important to consider how we can support these individuals, helping them adapt to current trends and stay engaged with technological changes that are shaping our field. The ability to adapt is at the core of our work. Every day, new trends emerge in substance use, mental health, and treatment approaches, including higher levels of care and outpatient services. As counselors, we must remain flexible, responding to these changes in an ethical and legally justified manner. To do this effectively, we need to weigh the pros and cons of technology integration in our practice. It's essential to be familiar with the technology that we use, not necessarily diving in completely, but understanding the systems at play. This helps us assess the benefits and potential costs introducing new technology to our work. Another factor to consider is the population that we serve. If we're working with clients who may not have reliable internet access or smartphones or even basic technology like prepaid phones, then we need to recognize that asking them to engage with certain types of counseling applications really just may not be realistic. And this highlights the importance of considering the accessibility of technology when integrating it into treatment. It's not about adopting technology, it's about how it applies to both seasoned professionals and newcomers to the field, as well as how it adapts to meeting the needs of our target population in culturally appropriate ways. Technology education is crucial, but it takes time. The demands of our field, where productivity is often prioritized and clients may see 8 sessions back to back in an 8-hour day, may find it difficult to carve out time for professional development. We need to stay updated with the latest trends and maintain memberships with professional organizations like the ACA and ensure ongoing education through continuing education credits, whether for areas of interest or areas of need. Confidentiality standards are paramount regardless of the type of technology we're using. For instance, providing counseling through personal cell phones does not ensure confidentiality. Distance counseling must be conducted through secure, confidential portals. Agencies that providers may need to invest in these types of platforms, which are designed to protect both the client and the provider's confidentiality, is equally important that may have information that we store, whether in electronic records or other forms, is safeguarded. The legal jurisdictional aspects of telehealth and technology driven counseling also pose unique challenges. If, for example, a psychiatrist in Pennsylvania is providing telehealth counseling to a client in Michigan, they must comply with the licensing requirements of both states. This includes understanding the client's insurance coverage and adhering to each state's guidelines. When counseling crosses state lines or internationally, privacy considerations may become even more complex. We need to ensure we are aware of all the relevant legal issues, including jurisdictional boundaries and privacy laws. As we explore the role of technology in counseling, we uncover many questions and considerations that require careful research and thought. It's our responsibility to do the necessary legwork to ensure that our use of technology in counseling is ethically sound, legally compliant, and ultimately focus on the welfare and privacy of our clients. Informed consent has been a key theme throughout our discussions here, and rightfully so. It's essential in ensuring ethical practice. Before any treatment can be provided, an individual must give informed consent. Without it, we should not proceed with services. It is important that our consent forms are regularly updated, typically on an annual basis, and that clients are fully informed of their rights and that they should be aware that they have choices in providers, in treatment options, and in therapists. What does informed consent involve? In the context of treatment, it means clearly identifying the rights and benefits associated with the proposed care, if we're recommending a higher level of care or discussing the possibility of a lower level. We must explain the potential outcomes of these decisions. This applies to various treatment settings, as well as distance counseling versus in person sessions. Clients must be given a choice, and we need to discuss the implications of opting for distance counseling. Additionally, we must prepare for technology failures, something many of us likely have encountered. If a session is interrupted due to a technical issue, it's vital to have a backup plan. Clients must be informed of this plan B upfront. In situations where a crisis arises, especially when assessing imminent danger, technology failure could severely hinder the process. Ensuring that a client's safety and having a clear plan in place is non negotiable. Cultural and language differences also need to be addressed, especially when working across state lines or internationally. We must be mindful of cultural and linguistic nuances to avoid misdiagnoses or misinterpretation of information. It's important we have a shared language with our clients to ensure clear communication. Additionally, technology etiquette plays a significant role in the counseling process. While distance counseling may lack some of the interpersonal dynamics of in person sessions, many clients find it convenient and effective. One of the many experiences in our agency is among the first to implement telepsychiatry in a rural area, and that looks like working with third party providers with behavioral health to help establish these services. And with satisfaction surveys, uh, we discovered that clients receiving telepsychiatry were, in fact, more satisfied than those that they received in person. They appreciated the accessibility and the ability to engage in therapy without the geographical barriers. And this experience challenged the belief that distance counseling is less effective. So, showing that in some cases, it can even meet the client's needs better. In time zone differences, we must also be considerate of when we are working with clients across various different regions. Clear communication regarding appointment times is necessary to avoid confusion. Similarly, we've discussed the importance of separating personal and professional social media. As counselors, we should never share our social media with our clients or disclose personal details that could harm privacy or the professional relationship. Finally, we need to consider clear policies and procedures when it comes to payment, especially for self pay clients. If a client is paying out of pocket, it's crucial to outline how payments will be collected in distance counseling settings. We also need to ensure that we have the appropriate tools and platforms in place to provide effective counseling remotely. These are key considerations for integrating technology into our practice and in a way that remains ethical, effective, and client centered. Privacy is a crucial aspect of our work, and it's important to approach it with care. Here's a way to think about it. Imagine that you're providing distance counseling for the first time. The client introduces themselves as Joe Smith, but how do you actually know that it's Joe Smith? It's essential to verify the identity of a person you're working with. We cannot afford to take risks or act unethically by providing treatment to someone who isn't the person that they claim to be. It's vital to take reasonable precautions to protect both the confidentiality of the information and ensure that you are working with the correct individual. For example, you may consider verifying their identity using driver's license or some other proof of residency. This type of verification is very important in fields like outpatient drug and alcohol treatment, especially when working with some type of medication assisted treatment for addiction. These regulations clearly state that when using controlled substances or those are prescribed, proof of identity must be obtained and kept updated. And if this verification is not part of the client's records, it could result in serious consequences, such as jeopardizing professional licenses or even closing programs, potentially affecting treatment for many, many clients. Regarding confidential information transmission, it's important not to become complacent with technology. When sharing client information via email, for example, always use a number or a code to identify the client rather than their full name. Most electronic patient record systems have an assigned client ID number that can be used instead. Avoid sending full names or other identifying details via email or phone or text message, as doing so could breach confidentiality. Always ensure that any documents shared electronically are done through secure encrypted channels with necessary passwords or codes to access the information. While encryption systems may come with additional costs, this investment can prevent costly breaches of confidentiality and potential disciplinary actions for unethical behavior. Another area of consideration is supervision and interdisciplinary teamwork, which is an integral part of many treatment processes. However, we must respect clients' privacy while working with other professionals. One way to do this is by using a umbrella consent for the agency, which allows clients to consent to sharing their information within the agency as part of their treatment process. For example, if a client receives services at XYZ Counseling, the umbrella consent would authorize the sharing of that person's information with anyone within XYZ Counseling. This umbrella consent helps ensure that you're legally protected when sharing information internally. Additionally, obtaining client consent for third party insurance billing is essential. Never assume that you have explicit or implicit consent to bill insurance companies. This consent must be given explicitly. Ensuring all consents are obtained and updated regularly is a key to maintaining legal and ethical compliance in your practice. I'm going to share some information about integrating mental health apps into treatment. This can be very beneficial and crucial to being intentional about how we implement these tools to ensure that they're meaningful and effective. With the vast number of mental health apps out there and available today, it can be kind of overwhelming to figure out which ones are the best to fit our needs, and it can be very easy to get lost in all of the various different options. As you can see here on the slide, one mental health program that is a very nice option is called My Strength. Again, you can click into these links from the PowerPoint and you can explore My Strength. It is an evidence based, clinically reviewed program that functions as a separate portal, which can be integrated into the electronic record of the client. This platform is designed to target specific client needs using evidence based practice. For example, if you're using cognitive behavioral therapy, CBT, for a client with depressive symptoms, My Strength offers a range of resources, including journaling tools, meditation exercises, and therapeutic techniques that clients can access outside of session. The program is highly focused on enabling clients to track their motivation and progress or looking at any setbacks towards their goals. It allows for incorporation of protective factors such as spirituality, well being, or inspirational content, which can contribute to their success. My Strength is structured around guided experiences with resources available for a wide range of presenting issues and needs. One of the benefits of this program is that clients can take ownership of their involvement. They can share their progress through the app with their provider, allowing for ongoing monitoring and tracking of changes over time, and many clients may find it motivating to see tangible results, which can be a very valuable part of the therapeutic process. While My Strength can be integrated into your electronic health record, it can also be a therapeutic tool that's important to ensure that the client has access to the necessary technology in order to use it effectively. Additionally, it does come at a cost, but demos are available on the website if you're interested in exploring it further. My Strength is just one example of many mental health applications that you can use to enhance your treatment, and I just wanted to share that with you. You'll see another link down below This is a list of the top 25 mental health apps. This is an article that you can easily access, and it's got a lot of insight into navigating the overwhelming number of options that are available out there to us in this day and age. It helps address the challenges of determining where to start and which apps are most appropriate for specific needs. These apps are evidence based and target areas that are key to focus on in therapy, offering different tools and can show progress towards achieving therapy goals and overall success. This website offers a list of various different apps, including mental health apps such as suicide prevention, mood tracking, mental health for children, addiction recovery, 24-hour support, habit tracking, anxiety management, and much more. So these are just a few examples of the top 25, but as you know, there's hundreds of apps available out there, and it seems like they're continuing to add new ones every day. So just know that these are options for you when working with clients. Have these conversations about integrating apps into the treatment plan, see if they're interested, assess whether it would be valuable to them, and discuss if this is a realistic option, and then determine how to incorporate this technology into your collaborative journey towards treatment goals. As we move on, we need to assess what's effective and what's not effective in our approach. Keep in mind that there's no one size fits all approach, and this is an ever evolving process. What remains constant, however, is the importance of maintaining confidentiality, respecting boundaries, and understanding the appropriate use and limits of technology. We must also acknowledge the differences in communication when not meeting face to face. With that, we may have more questions to ensure that we understand what the person is going through emotionally and how they're feeling. It's important for us to have open lines of communication and feel comfortable asking if that is something that you need. So let's be transparent about the risks and benefits of distance counseling. It's essential to communicate effectively and check in frequently with the emotional intelligence guiding those interactions. If for any reason this method of counseling isn't working, that's okay. The client's welfare and safety are paramount, and if they're not receiving what it is that they need through distance counseling, we may have an ethical responsibility to refer them to other services that may better meet their needs. Overall, when it comes to social media, there's an abundance of apps, just like what we talked about. We need to have some careful consideration. People use social media on a daily basis, and there's significant discussion around screen time and addiction to these, and negative effects of excessive phone and screen use. So many individuals, for example, might wind down at night by scrolling through their phones until they fall asleep, but research has shown that this practice is highly, highly ineffective for relaxing the brain, and it can prevent the mind from actually winding down, which disrupts sleep and prevents rejuvenation. While there's so much to unpack about the impact of social media, I want to focus on some essential tips for counselors in this area. First and foremost, it's critical to maintain your safety and the safety of others on social media. If you need to have social media, I recommend having two separate accounts, one personal and one professional. However, it is equally important to ensure your personal and professional values align. So if you feel that your personality reflects who you are as a professional, you're certainly entitled to have a private account. But remember that anything that you post on social media can potentially be seen by others. So ask yourself whether you want your clients to view or to know about things that you're sharing. If not, it might be worth reconsidering whether it's best to post. In addition to maintaining separate accounts, be mindful of what you actually share, what you post. It's critical to respect your client's privacy. Never browse your client's social media accounts to gather information. Doing so could lead to ethical dilemmas. For example, if you find information that contradicts what the client has shared with you in therapy, how do you go about addressing that? If you say, I saw on Instagram that you posted this, it can damage the trust in the therapeutic relationship. So avoid this at all costs and respect your client's personal space, just as you want your personal space to be respected. Additionally, be cautious about disclosing any confidential information online. Your actions on social media not only impact your own reputation, but also the credibility of the counseling profession as a whole. You are a professional, and how you conduct yourself online carries liability. Always take into account the ethical standards that guide your practice. In this module, you're going to find a wealth of tips on managing social media use. I encourage you to familiarize yourself with these recommendations, as you will encounter these situations with clients, as they will want to connect with you on social media. However, this is never a good idea to accept friend requests or follow clients. As counselors, remember, we hold that position of power and privilege, and these dynamics require us to be mindful in how we manage boundaries. Becoming friends on social media could potentially damage the trust, safety, and client's progress. So, just like with other ethical considerations, we must be aware of the power dynamics in our relationship with clients. They don't simply go away. As such, we need to be diligent about maintaining healthy boundaries, both online and offline. And it's important to have open conversations with clients about these boundaries. It is not personal, it's about maintaining professionalism, protecting both your safety and the client's well being, and ensuring the therapeutic process remains intact.